Today we're going to talk about the muscles in the vertebral column. The first muscle we're going to talk about is the rectus abdominis, and this muscle originates on the crest of the pubis and inserts in the ribs 5 through 7, as well as the xiphoid process, the inferior part of the sternum. These are the muscles that you see when somebody has abs, and we can palpate muscle movement in this muscle with flexion, which is decreasing the angle, so doing like a sit-up or a crunch or a motion like that. Next, we're going to talk about the external and internal obliques. The external oblique originates on the lower 8 ribs at the side of the chest and dovetails with the serratus anterior, so more laterally, and it inserts on the anterior half of the crest of the ilium. And we can palpate muscle movement in this with in the supine position, so laying on your back, and we can do this with active rotation to the contralateral or opposite side of which you lean. So the external oblique pulls the muscle, and the opposite side we can palpate, we can see that. Next we have the internal oblique, which originates on the upper half of the inguinal ligament, as well as the anterior 2/3 of the iliac crest. And this muscle inserts on ribs 8 through 10, and we can palpate movement in this with in a supine position as well on the back with active rotation of like doing a Russian twist or something like that. Next we have this group of muscles, the erector spinae muscles, and these muscles are the iliocostalis, the longissimus, and the spinalis. And starting more laterally, we have the iliocostalis. More medially to that is the longissimus, and then most medial is the spinalis. And these muscles run along the back like that. These muscles are hard to palpate, and because they're so deep. Next, we have the sternocleidomastoid, which originates on the manubrium of the sternum and inserts in the mastoid process of the head. And we can palpate muscle movement in this with rotating the head on the contralateral side. We can see that's this muscle right here. Next, we have two similar muscles, the splenius cervicis and the splenius capitis. And the splenius cervicis originates on the spinous processes of the thoracic vertebrae 3 through 6 and insert on the transverse processes of C1 to C3, so it runs up this way. And we can palpate movement in this with resisted ipsilateral rotation, so leaning your head to the side like that. It pulls these muscles. Next we have the splenius capitis, which originates on the upper half of the ligamentum nuchae muscle and the spinous processes of C7. And it inserts on the occipital bone on the back of the head, and it's deep to the trapezius, and we can palpate muscle movement with resisted rotation of the head, so like shaking your head no. The last muscle we're going to talk about is the quadratus lumborum, and it originates on the iliac crest and inserts on the lower half of the border of rib 12, so at the bottom. And this muscle is hard to palpate because it's so deep in the body.